Interesting video, but a topic definitely not to be toyed with: mental health. Now, the month of October is really packed with global events. On the 10th of October was World Mental Health Day. Yesterday was World Sight Day. And of course, you know, we are still celebrating breast cancer. We are creating a lot of awareness out there. And today is also Global Hand Washing Day. And Life Boy is just reminding you that wherever you are, please make sure that you wash your hands with soap under running water as many times as possible. You'll find their vending machines with soap and water everywhere across the city. So make sure that you find one and keep your hands clean. But away from hand washing, of course, it's all in a quest to prevent the spread of COVID-19. And we all know the devastating effects of COVID-19 on mental health. That's why my very good friend Anaba Sunday Atua, or is Atua? Atua. And now Sunday Atua is actually here from Basic Needs Ghana. He's also a member of the Mental Health Alliance and Development. And he's just here to talk to us about everything that's been ensuing from the 10th of October when the celebration started right here in Ghana. Good to see you, my brother.
Good to see you.
You are really my brother because you're from the Upper East region. So
true.
This is brother to sister. Good to have you in the studio. So run us through it. What has been happening from the 10th of October till now?
So yes, the WHO has set aside 10th of October every year as a day to celebrate mental health. And the day is to raise awareness about mental health and then mobilize support from stakeholders to support mental health policies around the world. As part of stakeholders in mental health, every year as a country, we come together to put activities that will help us raise awareness about mental health. You know, as a country, we have a lot of challenges. So we actually do not celebrate the day, but we make it a week-long activity.
Okay.
And so this year, together with the Mental Health Authority, the Ghana Sumobi Jomedie program, which Basic Needs is a part of, also a part of the Mental Health Alliance and WHO, we started the celebrations with a press launch on the 6th of October at the Fiesta Royale, where the media were brought in to listen to the issues in mental health, the issues that needs to be discussed and then push it forward. So it started with a big press launch, and then after that we had some symposiums. The Mental Health Authority actually went to schools and then gave them some educations on mental health around the country. And then as an alliance, we also came up with a press release, a press statement, telling government the things that we need them to do in the mental health front. For instance, the Mental Health Board, which is yet to be constituted. And then we asked government to constitute it so that the activities of the Mental Health Authority will be well streamlined, the function will be, they will be functioning properly. And then after that, we also had a seminar at the Fiesta Royale, where various speakers spoke on the challenges facing mental health, including mobilizing resources and how we can support mental health in the country. And so there were some media engagement, breakfast shows. We also had community level programs. At some parts of the country, there were some engagement with local level district assemblies. There were social media campaigns. And of course, there were also some, let's say, youth level activities. And as an organization, we also had engagement with service users, whom we have them in the community known as the self-help groups, where we engage with them and gave them education, where they themselves also took the education to their communities, including their chief palaces, including their local assemblies, and then promoted
And this has been done in all the districts in Ghana?
Yes, so not all the districts, but mostly districts that Basic Needs work in. We were able to do all this. Yes.
I'm interested in this conversation because a cross-section of the public think that once it's World Mental Health Week, let's put it that way, so these are things that you put together, seminars, and it's just talk. But practically, beyond this week, what have you put in place to make sure that if anybody suffers, if any Ghanaian suffers at any point in time of their life, suffers from mental health, what help actually can they get practically from people like your institution?
Yes, so when you look at the week or the day, it's to create awareness. But beyond that, a lot of things has been done. or we do a lot of things in the field. For instance, the Mental Health and Alliance continue with advocacy.
Okay.
And it's a civil society network where Basic Needs is a convener.
Right.
And if you care to know, Basic Needs is a mental health organization in the country working and implementing policies about mental health in the communities.
Right.
So basically, Basic Needs works in the communities more. And core to the operation of Basic Needs is the formation of self-help groups, where the groups sit together, talk, people who have mental illness,
they come out to share their
experience, and then begin to support one another, access treatment. Now, the other thing is the challenges in mental health in 10 years ago is not as it is today, because in 10 years ago, or let's say before 2012, the coming into being of the Mental Health Act, there were no community psychiatry units. We had just 3 psychiatric hospitals.
But now we have them?
We have community psychiatry units in the countries where when you have a mental health challenge, maybe your district hospital or your district level health center, you can just go there and access some treatment. So that is it. After accessing treatment, mental health treatment isn't just one. It's not only about psychiatrists. It's not only about psychologists. We also have the talking kiosks. We can also get in touch with Basic Needs Ghana, where you will be linked to a self-help group by you, where all our programs are centered on. We reach out to the self-help groups through our volunteers, give them trainings, give them training on capacity, we build their capacity about themselves, about mental illness, and that is where we reach out to them with various training models.
Touch briefly on COVID-19 and mental health for me in just a minute.
So that is the COVID-19 itself presents a mental health challenge because of anxiety. And now, during the peak of COVID-19, and like I said, this year the celebration is on mental health. The theme is mental health in an unequal world. So during the COVID-19 period, the lockdown, there were food distributed, government distributed food and items and all those things. We didn't see them actually extending it to people with mental illness. Some of them, most of us, we think about the destitute, but there are some of them who have mental illness, who even shy to come out. They were not included. Data hasn't shown that this number of people were included. Now, when it came to the vaccination, there were key population prioritized for
the disparity.
For earlier vaccination. But people with mental illness were not part of those key populations. There were times that we moved to the hospital thinking that we will also get ourselves, because we have groups, we move with them to the groups to think that, to see that they also get vaccinated as early as possible. But they tell us, no, they are not part of the prioritized population. So we are asking government to actually look into some of these things and see that these people are also prioritized. Whenever you have a program where you are considering the vulnerable, they are the vulnerable or the vulnerable, because mental illness itself has made them vulnerable. And so they need to be prioritized so that policies can reach out to them.
Fantastic. Is there a helpline anybody out there can call?
I think the Mental Health Authority has a helpline.
But Basic Needs...
But basic needs, we can give you our website.
So what's the website?
www.basicneedsghana.org. You can look at all the things we do. And also you can our numbers are there. You can call if you want to talk to us. And if you want to be part of the movement,
you can also become
support,
a part of it.
You can be of support. Yes, but most importantly, the Alliance is a network that is made up of different NGOs working in mental health. Where we have regional branches, and then all of us are pushing the agenda.
And like all under Basic Needs Ghana.
Basic Needs Ghana is the convener of the Alliance, but it's under the Alliance. Yes. So people like you can also be part of the Mental Health Alliance, where you can showcase issues of mental health in your shows, and then we can get to a point where mental health will be all over in Ghana. We'll talk about mental health. We pray for that day. That day we'll get to that we don't have mental issues in Ghana anymore. Sunday, no, Anaba Sunday, it's here. It has to be pronounced that way, right? Anaba Sunday, it's here. Atua, I keep saying it's here. Atua, he is from Basic Needs Ghana and also a member of the Mental Health Alliance and Development. Thank you for your time, sir.